On this episode of the ASC podcast with John Goehle, we discuss how we are surviving the coronavirus crisis, what our new world looks like, educational opportunities during the period of isolation, COVID-19 lessons, what the survey landscape is likely to be and how to prepare for it, and predictions for the rest of 2020 for ASCs.
This episode of the ASC podcast with John Goehle is sponsored by Ambulatory Healthcare Strategies. AHS is the ambulatory surgery industry's leading regulatory and financial oversight firm. Organizations that outsource their regulatory oversight to ambulatory healthcare strategies have an edge. AHS works with ASCs to oversee their quality improvement, risk management, emergency and infection control programs, run their meetings, develop education programs, and always be prepared for surveys. Welcome to episode 103 of the ASC podcast with John Goehle for April 26, 2020, recording live from our studios in Spencerport, New York. This is Sue Cronkite, Chief Researcher for the ASC podcast with John Goehle and Senior Nurse Consultant for Ambulatory Healthcare Strategies. Joining me from our studio in Spencerport is John Goehle, recognized as one of the nation's leading experts in the ambulatory surgery industry. Boy, it still surprises me, 103 episodes.
I know. And did you notice that you said live, recording live from our studio, since that's what the script says?
Yes. I just read. I don't know.
Well, we've been doing live podcasts for 2 months.
I know.
This is our first time not doing a live podcast in 2 months. You know, and the thing is, I look forward to this. I think we kind of look forward to the live ones, but it's so different. You know, they're so stressful. It's usually, we write a script in a very short period of time. There's very little that's actually scripted during a live podcast. And we have to be careful what we say because we know that it's going out and we can't edit it.
Yeah, like my spider incident when I had to step away for a minute and you heard me saying some things in the other room.
We probably need to describe what happened. We were doing a live virtual conference, and I was speaking, doing my session, and Sue went off to
the other room.
a certain room next to the studio here, and all of a sudden I hear her scream as I'm going through, my stuff, and I'm thinking, oh my goodness, I wonder if she fell. And I'm watching the door, I'm watching my script, and I'm watching all the levels here, and then I thought, I've got to stop. So I said, excuse me for a minute, took the volumes down, and then, I opened, and it turns out I was
being so discreet in there, and then I hear you turn down the thing and go, are you okay in there? And okay, there was two big black spiders, and
so.
It
was about, you told me it was about a foot big, but I think it was only a couple inches, but it's still a pretty big spider.
And you're nice to say I screamed. I may have screamed certain things, but
well, it is nice to be back to a recorded episode because it's much more relaxed, and we can do it on the weekend, and we can play with the puppy in between takes. So we are, now we've upgraded so much of the equipment. We'll talk about that in a few minutes, but we've upgraded so much of the equipment now. The one thing we haven't done is taken care of our cell phones. Sorry, I forgot to turn that off. But we've upgraded the equipment so we can do a lot less editing actually in between. Yep. So
that's good.
And speaking of the puppy, do you want to give an update on our puppy?
Sure. She's 12 weeks old now. You say she's spoiled rotten, but I know I just think she gets what she deserves because she's a wonderful puppy.
She is, and she's been training us very well.
Yes,
we've been trying to train her, but she's been doing a much better job at training us.
She's just so sweet. She does,
is.
She does have a UTI, so we've had a few little accidents, but we're treating her for that. And, she's so sweet. She plays games with us. We've been taking her out for walks.
I was gonna take puppy paternity leave, when we planned this because we had put a deposit on her. I think it was last year. I can't remember exactly when. So well before any of this happened, and we had to pick her up in the middle of the coronavirus here. But I had intended to take, I think, about 2 weeks off the road when I wasn't going to travel. So poor thing's now, I think she's just waiting for us to get on the road.
I know. She's like, would you
heck
people
out of
just leave?
town.
But
Leave me
we
alone.
actually are. We're trying to, sometimes put her in her pen and just to
Yeah.
kind of get her used to if we're not there. And we're also trying hard to socialize her without being able to be near people.
Yeah,
So
that's
it's
tough.
been a little tricky, but we wanted to make sure she's, well adjusted.
Well, if you hear in the middle of that, it'd be hard in the studio to hear her that far. But if knowing her, she might be able to make enough noise to get past the studio walls. But,
I don't know. I gave her peanut butter mat.
Oh,
so we have
she's
these
happy.
little silicone mats, and you spread peanut butter on it. It'll keep her busy for
we
a
are
little
going
while.
through a lot of peanut butter.
I don't blame her.
Yeah. Well, of course, I eat a lot of peanut
Yes.
butter, so it's one thing that she and I
Between you
have
and
in common.
Rosie, the two of you.
That I opened that jar yesterday. It is halfway gone already. Oh, well,
But
it's-
you baked,
yeah, that's true.
which you've been doing some of.
Well, let's talk a little bit about what's going on personally,
Yeah.
too. First of all, we have been very blessed. Both of us are in good health. We haven't had any real problems at all, and our families are generally also. I think we both have elderly mothers who are, we're scared for, obviously, but they've been very good so far. Just the social distancing thing is very difficult, I think, for the elderly, and, they're trying to get through it. But I do miss seeing people. Of course, now there's these Zoom sessions. This is a new term. I never even knew what
Zoom
Zoom was
session.
before this, and now, our entire life is
Yeah.
around Zoom.
Well, it amazes me that my mom can, because I Zoom with my mom, my sister, brother, either one of my kids or both that can come on twice a week. We do it. And my mom's actually, she never even would check email before, but
Yeah.
she actually can go on the email, get the link, go on there, and we've been, just if people are trying to connect with their families, one of us will pull up either an old video or,
Yeah.
some of our old pictures and share the screen, and it's just a fun way to, to connect, because after a while, twice a week, how much can you
Yeah.
say when you've just been home all week, but, we've been sharing pictures, and it's kind of fun.
With my side of the family, it's pretty much you have to set up the camera so that you can see the entire
It's all
living
about the
room
dogs.
and the
Yeah.
dogs. Right? We have all of our family members have dogs or puppies. My youngest daughter has a puppy.
Doesn't look like a puppy anymore.
Doesn't look like a puppy
He's-
anymore. I haven't seen.
a
Well, I saw him in
big
the
guy.
car. Right? They came by one day with the car, but that's not quite the same. But yeah, so that's pretty much what happens on my side of the family there. Yeah, by the way, we do Zoom so much. You realize we have 3 Zoom accounts?
Yes,
now?
because I use one of them all the time. Because if you pay for it, you get the more than 40 minutes, and
That's
I
right.
find we tend to run over that. So.
Absolutely, yeah. It's been, the 3 Zoom accounts, man. We didn't even have one before this whole thing started. We're also cooking a lot more. I spent the morning, I got up before you did. Well, the puppy got me up at, 5 this morning, and which is becoming a normal thing. So I decided to bake a little bit, and I haven't baked since I was a kid. I'm having fun doing it. We're not eating out, of course, and we're not even doing delivery anymore. We
No,
had
we've
that
done a couple, but
Yeah.
honestly, and then we ordered a couple pizzas, and we had to, because we're keto,
right.
so we ordered the keto crust pizza, and then my daughter was here overnight. She had she had broken her nose at work, so I had
Yeah.
to have her over for the night after surgery. And she got a gluten-free one, and it just wasn't that good. It's sometimes you find you do better on your own.
I know. Well, the same thing with that steak that I ordered the other day. I said, why? It's just funny how we're,
Yeah.
all these things are changing.
Yeah, I think we'll find that even after we get back to normal, hopefully we'll continue to cook more at home still and do some of those things.
I was reading somewhere they were talking about how I guess some nutritionists are telling people to, believe it or not, don't worry about eating comfort foods and eating plenty of carbs. And of course, on the keto diet, which both you and I have been on, though I've been on it longer. I've lost 90 pounds since March 17th. I was going to celebrate, March 17th of this year. Then of course all this happened. But 90 pounds over the past year. But I can't imagine going back to it. And it's been actually pretty easy to maintain, even during this period of social isolation. And I think it really has been very healthy for me. Maybe
Well,
I'll
you're
be
so
able to-
much healthier than you were last year.
Yeah,
Sorry to interrupt,
very
but you
sick.
were,
Yeah.
I remember last year you had a cough through most of the year. Was your allergies, just different things? And this year you've had no issues.
That's right. All because of keto, really. And it helps me keep up with the puppy. I don't know how I would keep up with the puppy. Though I was outside because the thing about having a 12-week-old puppy is she has to go frequently. So I get up at 3 o'clock in the morning with her to take her out. And we have certain animals.
We
now
do. We
who
have baby
visit.
foxes that
So I
are
was-
living underneath our shed. They're so
Yeah.
cute.
I'm always worried in the middle of the night that they're going to come up and attack me and the puppy, but they are just adorable.
Yeah.
Like a cross between a dog and a cat. Mm-hmm. We'll have to
Very
post some
cute.
pictures up there.
Yeah. I put a bunch on Facebook. I can't resist taking pictures. I just hover by the window. And actually, they're little enough I can actually walk out by them unless the mom sees me, and then they all run because they know she sees.
All the way, I mean, and what are we?
so
We're
funny.
100 feet away from her, and she
Yeah.
still worried about us?
Yep.
We probably should use all that fancy video equipment that we have for for these podcasts or video podcasts to take some good videos of them.
Yeah, but we have been really, really busy. It surprises me with all of what's going on that, you'd think there'd be some downtime, but it's actually been, I think, even busier than normal.
We as a company, we've definitely been busier than ever before. The regulatory aspects of the isolation, the shutdown of many of our centers, more than half of our centers are shut down. Of course, the whole issue of what is an elective versus non-elective, predictions about when we're going to start up, all the regulatory ramifications of that.
Yeah.
Our days, but despite this, our days seem to have fallen into a rut. As a company now, we see more of each other, albeit on Zoom. Every day we have a meeting at about 10 o'clock in the morning, and we go through what's going on. We write a morning update for all of our ambulatory healthcare strategies clients. And by the way, at least for now, you can see all of those morning updates since the beginning of the coronavirus. It's on our ASCpodcast.com. So feel free to read that. There's a lot of free information up there that you can use to make sure you're staying on top of things. And so that's our morning, writing that update and then sending it out. And all of our full-time employees are on the line as we put that together. And then, of course, we live in New York, which is the epicenter of this whole crisis. Yeah. And we have to listen to our governor. He usually speaks around 11. And, we push out a lot of information from him. I know that, we have a national audience, and, of course, a lot of our clients are in other parts of the country. But definitely what happens in New York seems to be, have a bearing on the rest of the country. Yep. And then we try to interpret the impact on our ASCs and try to keep up with the regulatory changes. Hopefully, our audience has been keeping up with these recommendations. If not, please visit our website at ascpodcast.com. There's just a wealth of information there. And then, of course, our day ends with listening to the president and the COVID-19 task force. And sometimes those things go on for 2 hours. Well, luckily, we can eat dinner during that. So, and we try to figure out what and from that, we hopefully get the bigger picture. But it's been, it's been very busy, certainly, and I know that we're trying to figure out what our new normal is going to be. And then there's just a lot of changes that are occurring with the podcast and with our studio. Just after the crisis began, we built a video studio, and we have a lot of equipment for it. And after probably what was up for about a month and a half, we decided we didn't really need it. So we've converted that space and the equipment into a backup studio. So when we do virtual conferences, there's always a backup in case the main studio goes down. It'll also be useful in the future when we have larger groups of people. Hopefully, we'll be able to do larger groups of people, especially our company. And
I'm sure eventually.
And then we converted this studio, the one we're recording from, for video. So now, much to Sue's chagrin, we have 6 cameras in here. Did you know that we have 6 cameras?
I'm trying not to pay attention. You promised me they're not on.
They're
today.
not on. No. None of them are on. We have 6 cameras in here from every angle. We have a green screen behind us, which I have to admit that's actually kind of nice because the wall was starting to get a little bare back there. So. With the new setup, it's great for virtual conferences, and that's becoming a big part of our time, too, is working on those things. And really has involved a pretty significant investment in equipment. The UPS truck seems to be here every day delivering something new. We had to replace all of the computers to handle the live podcasts and the virtual conferences. We have all those new cameras. Next week, I forewarned Stu that we have a teleprompter coming in, which will help us to, when we do video conferences, we can look at the teleprompter and look at the camera instead of looking down all the time.
Away.
So I think that'll be nice. The big thing we learned from our first virtual conference is that we needed a faster connection to the internet, so we had to upgrade that. Your microphone is squeaking there. And usually we would just edit that out, but now we're just getting to the point where we leave things like that in. We installed a faster connection. We have a new hardware to go with it. We have new services. We're using the Zoom webinar software for our video conferences. This might be a good time to encourage our listeners to support our podcast patron program, also known as the ASC Central Membership Program. Visit our website for more information. But support of the program helps us to keep this podcast free. And of course, we probably need, or we should, mention the support of our sponsors who really help to pay the bills too. We have sponsors who will sponsor specific episodes over the next year. And, of course, we got our producing sponsor, Ambulatory Healthcare Strategies. We've got Surgical Information Systems, Encompass Healthcare Data Solutions, BHG, Patient Lending, and Medicus IT. So thank you for the support that those organizations have. And I think one of the things I'm proud of, too, for those that don't know, I'm a pulpit supply minister in the Presbyterian Church, and I haven't been in the pulpit, the actual pulpit, since January. So we've been using this wonderful studio to manage church services for a group of Presbyterian churches in the western part of New York State. So that definitely is keeping this place busy. I think I spend more time down here than I do on the computers upstairs in the rest of the house. Sue, you wanted to talk, and I thought this might be a good time to kind of talk a little bit about post COVID-19. What's happened personally and professionally here. So
just some thoughts on how things have changed and how they will probably continue to change as we go forward. Some of it we've already talked about, like the working from home, but I do wonder if there's going to be more emphasis on that even after especially as we're ramping up, for people to be able to work from home if they can, save on the travel time and the gas, whether that's more efficient to be spending more of your time at home working rather than driving to and from work. So I think
we've all been used to it because that's how our company is virtual and all of our employees work from home, so we're kind of used to it.
But even as we move forward, less travel. I mean, obviously we're going to be excited to get back to see our clients, but some of it may be there may be more things that we can do from here. Other Zoom meetings or things like that.
Well, and I think we've proven how efficient those Zoom meetings can be, and how different a Zoom meeting or a virtual. When you see somebody's face, and it's very different than a phone call.
And just a phone call.
Yeah.
And sometimes it's easier to get everybody together rather than trying to schedule. Okay, we're going to be in New York City, and you're going to be here and there. So if people can Zoom, it could be better for everybody sometimes. Right.
It's actually much more efficient, I think. So I agree with you. I think that's going to be different. I think it's also, and the other fun stuff is we've been playing more board games lately. Checking on family. I think sometimes we actually spend more time, now during this crisis talking to our family members. Maybe not in person, but at least there's more regular check-ins on them.
Well, with our Zoom, I'm seeing my sister and brother a lot more.
True.
They would come once a month. Or every other month they'd alternate to see my mom because they live out of state. But we're definitely doing that. Like you said, we're cooking more. I think a lot of people are doing that, spending more time. I'm starting to do some yard work, which I really haven't had time to do
terrifying
in the last
poor
few
puppy.
year. I know. But it's probably, only when I drag the garbage cans in and out. She doesn't like that.
Most dogs don't like vacuum cleaners. We haven't tried the vacuum cleaner. That's probably not something we should admit. Oops. You can cut that out. The yard does not look good right now, though. We have a lot of work still to do on that.
Yes, there is a lot of work to do. And I think just for our centers, I think there's some good news is because they're a much more personal, smaller setting. I think people will probably be more comfortable getting back after this, where we're getting so used to the social distancing. I think people will be happy to go someplace where they're not having to worry about, very ill patients being nearby. I think we've proven our great, infection control and.
less exposure to seriously ill patients. We just found out my mother fell this morning, and the first thing when I saw the text message, my sister was a lot closer to her, was, "Oh my God, I hope she doesn't have to go to the hospital." And I don't think that's going to end when the coronavirus ends. I think people are going to be very leery to go back there, and hopefully they won't be leery going back to ASCs. And I think that's a big thing that we're going to have to do is emphasize to our patients, spend a lot of time with them on the phone beforehand, and of course, as an industry, emphasize how careful we are on an infection control standpoint.
Helping everybody to be comfortable. And as I had mentioned, my daughter she works with seriously autistic young people, and there's sometimes some violence that goes on, and one of the kids had headbutted her and broken her nose, and I thought, is anybody going to be, are there going to be any ENTs? And we did end up, she was able to go on, but they did a Zoom session for her pre-op, and then she just had to go in. She was actually tested for coronavirus before she went in, but it was definitely, I would not have wanted her to go to a hospital for that.
Well, and I think the telemedicine side of it is going to be interesting there. I've been doing some, consulting with national organizations that are trying to figure out what the future is going to look like, and that's one of the predictions that we've made is that telehealth is going to really become a hot topic right now. And I think for ASCs, there's limited amount. I mean, you can't do surgery telehealth.
But the pre-stuff, and then come in and then do the listening and the looking and that.
And it could probably be stronger too, because you're going to have a little bit more time on a phone, perhaps, or on a Zoom session than you will,
and more time in person listening and doing things rather than asking a bunch of checking off a bunch of boxes that could have been done on the phone or through Zoom.
Yeah, and I think a lot of our centers still do those phone calls to patients preoperatively, but I think doing a little bit more telehealth where you can see them and ask them questions, and maybe they can show you things that that you need to see visually. But
I think just getting people to think outside the box, because we're having to rethink everything that we're doing, and that's a good way of getting creative and finding out new ways to do things in the future.
Yeah, and I think we've been extremely creative in this industry during this time. Not only that, I have been just so proud of the way our ASCs have stepped up. And people in general, I think, have stepped up. We're seeing an awful lot of wonderful news stories out there, thank goodness, during this time. But the ASC industry in particular, we've seen them donating supplies.
There was a hospital that was running out of propofol.
Right.
And I had mentioned this on an earlier podcast, but within, I think the call went out, or the text went, and people were saying, "Hey, we've got some," because if somebody runs out of that when they've got a lot of patients on the bed, that's not a good thing. So
without a thought about
they
what
didn't even
think about the ramifications for themselves of giving it up. And that's what I think makes our industry so special, is that we are willing to do that all the time.
Yeah.
I do want to kind of reemphasize the importance of visiting our website at ascpodcast.com periodically if you haven't looked at it. I'm actually surprised, Sue, sometimes when I've been talking to some people during this time when they've called me up about the conferences, or I have some people that have been trying to get AEUs recently, and I'm surprised that they don't know all that information that's available on the website at ASC.
And there's a lot of information, but if you go in and just scroll through it, it's pretty well organized.
Yeah, kind of.
Well,
I'm not the greatest webmaster. There is a lot of information. And it's been tough, really, to organize, and we're trying to figure out a better way to do it. But,
and there are some links. So the beginning is to click on the...
Yeah, so if you go to our website, first of all, I'm not too fancy, so there's just a lot of words on the page, and but I mean, I think if you read, the links there, click on those links and play with it, you'll be able to find things very quickly. But all of our daily updates are up there. There is an action plan.
That's what I was trying to think of. I'm sorry, I couldn't think of the day.
Yeah, the action plan is up there, as well as a lot of links to some of our educational resources. This is a good time to kind of catch up on your reading. in
Do
February.
you know of any useful
I
books?
do indeed. So I published the Survey Guide for ASCs, a guide to the CMS conditions for coverage and interpretive guidelines for ambulatory surgery centers, 2020 edition. I got to come up with shorter titles. We published it and updated everything. Of course, now we're going to have to update it again. I don't know if I have a 2020A edition. No,
I know.
it takes so much to publish one. I can't wait. I'll have to wait another 6 months, 9 months. But the 2020 edition of this is the industry's most widely respected tool for preparing for Medicare surveys, and it was revised in February 2020, and everything was current up until then. Seems like such a long time ago, doesn't it? We all know that Medicare and accreditation surveys are getting tougher, and understanding the conditions for coverage for an ASC, as well as how they are interpreted by Medicare, is critical for ambulatory surgery center leaders. So this resource, which the story behind this is I created this probably about 10 years ago as an internal resource for myself. And I cross-reference the conditions for coverage with the interpretive guidelines and the clarifications, and then just indexed everything. And then what I found is, oh, wow, this is a great tool for other people, too. So I started selling it, and it quickly became the most widely distributed book about surveys in the United States. And also included in the book are copies of forms that surveyors use, and the emergency preparedness regulations are in there, as well as all the clarifications up through February. So it's really an essential resource for every center owner, administrator, nurse manager, and business office manager. And a supplement to that is the survey checklist for ASCs, which is a tool for the CMS conditions for coverage and interpretive guidelines. And what this does is it supplements the survey guide and allows you in a checklist format just to kind of evaluate how well prepared you are for a CMS survey. And I co-wrote this book with Alex Borneman, our Director of Operations at Ambulatory Healthcare Strategies. And the third book, which is much shorter because it's written for governing body members and owners, which means doctors mostly, so it's got to be like only 100 pages long. Right to the point. It's a guide for ambulatory surgery center owners, governing body members, about their responsibilities when they take on that role. And I think I'm always surprised at how little they often understand about that. So definitely check out these 3 books, and you can pick them up at reg-books.com. That's reg-books.com. So, Sue, we didn't even know the term virtual conference until this whole thing happened, and now they're the rage. Every website you go to, you're going to see, people talking about conferences. And the ASC podcast with John Goehle has become the ASC industry's leading provider of virtual conferences and seminars. And what I like to emphasize is attending a virtual conference or seminar from us is not like listening to a webinar. Webinars are boring. I hate doing webinars because they're just so you just don't know. I always have this paranoia that people are laughing at me at the other end of the line as I'm going through it.
Well, you like it to be interactive, or feel like you're.
I like to see my audience.
Yeah.
So our virtual conferences are not boring. What's different about our conferences and seminars is that, first of all, they're relevant and timely information, which is a given right now. And I think we present them in an entertaining format. And of course, we're providing them by some of the industry's top speakers and content experts. We also provide AEUs and IPCHs if you hold the prestigious CASC or CAPE credentials. And if you can't attend our conference or seminar live, you can always get the recordings and listen to them at your convenience. That's a real advantage, a very high-quality image. And by the way, we did all of our recorded conferences you can actually watch on your TV. I know that doesn't sound like something that we normally want to watch on our TV, but at least you can put it on the big screen TV.
Yep.
I showed it to Sue the other day, and she wasn't happy.
No, but it's, if there's slides and things, that, sometimes it's important to be able to see those, in a larger format.
And you can also, instead of sitting in front of a computer, you can watch it in your living room and take notes, and it's a little bit more convenient, I think, in general. Or, if you're doing it from the center, you can do it in the lunchroom or, wherever your big screen TV is.
And I think there's a lot of benefits. You don't, you can listen to it over and over again anytime you want. You don't have to pay the expense of traveling to the conference and dedicating those 2 days or a full day. You can kind of break it up.
It's interesting. We can see the statistics. So for two of the conferences that we've done, they've been recorded, and we gave the a recording for free to the people that attended them live. And so far they've only been out there for like a week and a half. People have listened to 500 hours of it. So clearly,
really? Yeah.
Clearly there's a lot of good information that they're reading.
And it makes sense because I know when I've gone to conferences, I may take notes, but still, once you leave and there's just so much information to absorb, it's nice to be able to, go back to certain areas that you maybe want to refresh yourself
Right, absolutely. And, we also, let's not minimize another part of this. You don't have to spend money on travel.
Yeah.
We've been...
It's a huge thing.
Yeah. I know. I got to figure out what's happening with Delta, but I think I've got about 1,000, maybe $1,500 worth of plane flights that I wasn't able to take. We probably won't be flying anywhere for a while. So there isn't the expense of travel to attend a regular conference, and definitely can save a lot of money there. We currently have two conferences or seminars that are available, recorded, with many more to come. So let's talk about what's coming up. This week, we have the ASC Roadmap to Recover, a virtual conference to prepare for reopening in the new world. That's Thursday, April 30th. And this is what we said. Reopening or ramping up elective procedures in your ambulatory surgery center is not going to be as easy as opening the doors or scheduling more patients. We've got to realize that in our new world, things are going to be very, very different. So, we hope people will join us for this interactive full-day conference to discuss the process for reopening and restarting elective procedures for ASCs and issues related to performing surgery during and after COVID-19. This conference is going to be free for all of our clients and ambulatory healthcare strategies, that retainer clients, and it's only $99.99 for all others, $99.99 for all others. I think it's interesting when we first put this idea together, I thought, well, maybe it's going to be a 2-hour, 3-hour. Well, we ended up with 6 hours. I don't know that it'll go that long, but we've kind of planned that much time for all the material that we have to talk about. So if you want more information about that, you're going to have to sign up pretty quickly, of course, if you're listening to this late. Definitely go to the ASCpodcast.com website or see the show notes also. I'm going to list them in the show notes. And what I'm really excited about coming up is the ASC Finance, Accounting, and Reimbursement Seminar. So this is presented by Coding Compliance Management and the ASC Podcast with John Goehle. It's on June 11th and 12th, 2020, and is also virtual. Ambulatory surgery center administrators, nurse managers, and business office managers face unique challenges in managing the financial aspects of an ASC. So join us for this 2-day intensive virtual conference to discuss all aspects of finance, accounting, and reimbursement in the ASC setting. Sponsored by the Coding Compliance Management and the ASC Podcast. And Christina Benton and myself will be putting on this conference, doing most of the speaking for it. And it's really ideal for anyone interested in understanding basic financial principles like nurses, since I guess you didn't get an awful lot of finance in your nursing school,
nope.
Sue.
Don't want it. I guess, but I guess you do need.
Yeah, you do need it. I'm sorry to say that.
Yes, it is important.
It'll really help you to learn much more about it. I think it'll help you prepare if you want to take some of the certification exams. We're in the process of applying for AUs for CAS certified administrators and CEUs for physician practice managers, coding and billing professionals, and that are certified through AAPC. So go to our website at ascpodcast.com or, again, see the show notes for this episode. And interestingly, Christina Benton and I, who are very good friends, have been planning this conference for the last 4 years, Sue. And we've been trying to put it together. We've been just all kinds of problems. Christina moved from Baton Rouge to North Carolina, which put a whole year delay, I think, in the process. And we were planning on it for 2021. And I just wrote her an email a couple of weeks ago and said, what do you think about going virtual? Yeah. And then we just said, why not?
Just took off from there. And I do want to clarify, by the way, I'm always joking about how I don't like finance, but, it really gives you such a better overall view of just everything, especially when you're talking ASCs, because you kind of need to know a little bit about everything when you're part of it. So,
and you're better prepared, I think, as a nurse to understand why some of the decisions that financial people make. I mean, I'm not going to defend all the ways we do things, but definitely it's a different world that we live in. And then we have 2 recorded seminars. So you already missed them. The ASC Infection Prevention Coordinator Training. So we know that CMS and the accreditation organizations in most states require ambulatory surgery centers to have infection preventionists that are specifically trained to oversee the infection control program in an ambulatory surgery center setting. And up until now, your options for such training has been very limited. Not anymore. We developed a program specifically for ASCs with our friend Lori Rodricks, who is the Director of Clinical Services for Ambulatory Healthcare Strategies, and I moderated this one day. It was a full-day conference. We recorded it live, but now it's available in a recorded format. This is a training program to prepare nurses for the role as an infection control coordinator, or to improve the skills of infection prevention coordinators in the ambulatory surgery setting. It's a full-day course which focuses both on the basic skills necessary to become a coordinator and to build on skills that current coordinators already have. And particular emphasis was placed on the infection control challenges of our current environment and preparing for what we know are going to be much more rigorous surveys in the future. So if you haven't, even if you've had training, infection prevention, you need to demonstrate ongoing training in it. So this is one way to prove that. Yeah. The course was approved by the Board of Ambulatory Surgery Certification for 5.75 IPCH credits. That's for CAPE certificates, and also 5.75 AEUs for CAS certified individuals. At the successful completion of the program, you'll get a certificate to prove that you have received the training, and you can print out the agenda and slides to show surveyors what you learned during it. And the program is broken into 4 parts. First part is the role and responsibilities of the infection preventionist. Second part is developing an effective infection control plan. Third part is performing an infection control risk assessment, and then we end in part 4 with performing an infection investigation.
And as you said, there is going to be such a heightened focus on infection prevention after COVID.
So definitely this is a great alternative for you. For more information, go to ascpodcast.com and follow the links for the ASC Infection Prevention Coordinator Training. And the thing that we had an awful lot of fun with is in a couple of weeks ago, we did It's a New World Conference 2020. It was a virtual conference for ambulatory surgery centers. It was recorded on April 14th and the 17th. The nice thing about doing virtual conferences, you don't have to put the days next to each other. Yep. So we did it on a Tuesday and a Friday. And attendees who listened live, and anyone that gets the recording, can use their valuable time right now to improve their skills and learn some new things. We know that an awful lot of conferences have been canceled. If you're CAS certified, your opportunities for picking up AEUs might be somewhat limited when we start ramping up our procedures and have limited time. So this program was approved for up to 14 and a half hours of AEUs and up to 1.0 hours of IPCHs through BASC provider number 2618. And it's actually 7.25 hours per day. So in each of the days, there were 7.25 AEUs awarded. So you can go to ascpodcast.com for the agenda and to sign up for the recorded version of this. And we had a whole bunch of conference sessions. One was on surviving the challenges of a changing world. Lori and I did one on survey preparedness. I did one on ASC governance and governing body member responsibilities. Judy did a wonderful session on radiation safety requirements in ASC. It's probably, I think at my age, there aren't a lot of things that I haven't seen before, and that was a session that I really needed to watch, and I learned a lot from it.
The pharmacy was
the pharmacy was really good. He was a great speaker, and we had some conversations about re-energizing the revenue cycle, ways to kind of save money, because we know things are going to be very challenging in the future financially. Also, we had 2 lawyers on. I'm always leery about putting lawyers on, but they're very dear friends of mine, and they did a fantastic job talking about contract considerations. We learned a lot about those contracts that we have in the ambulatory surgery setting during this thing, because we never thought about what happens when there's contract provisions in there about what to do when you can't actually provide services, and that really came to a head. So there was a lot that we learned from that, and our speakers talked quite a bit about it. And we also learned quite a bit during this conference about personnel issues such as the FLSA, the FMLA, et cetera. And of course, Lori did another session on infection control. What we call, the title was a heightened sense of awareness coming back from COVID-19. And then we had 2 wonderful panel discussions. That was my favorite part of the discussion. discussion. On Tuesday afternoon and Friday afternoon, we had all of us, and if you look at the recording, you can see everybody on the screen at the same time having a discussion. It worked very civilly. We didn't talk over each other in general, but a real kind of deep conversations about what's next, how we recover from this situation, and what I think is going to be the leadership opportunity in the future. I think as an industry, the ASCs can really lead the healthcare industry into the future, and then also kind of the individual challenges that leaders within our own organizations will have as they move forward. So, granted, again, it's a New World conference. It was a 2-day live conference. You can get a recording of both days now at ascpodcast.com. And I guess we should also mention ASCA 2020, unfortunately, had to be canceled. That was going to be next month in May, and they transitioned also to a virtual conference and expo. They recognized that it really was impossible, unfortunately, in the current environment to get all those people together. So this is scheduled for July 9th and 10th. It'll offer the same top quality education, networking, and resources as ASCA's in-person events, all from the safety and comfort of your home or office. And during the virtual event, you can participate in live interactive breakout sessions led by industry experts. You can hear from inspiring featured speakers such as myself. I'm a little disappointed, though. I'm going to have to record it beforehand, so I don't know how that's going to go. But I have to be listening in while that presentation, which is pre-recorded, is going on, and then I'll be answering questions live. I think they type them in. I think that's how it works. I don't think we actually can hear them, but I'll be answering those questions live. So make sure, if for no other reason, but to listen to me. And it'll be a great session. And you can watch recordings of other sessions presented during the conference. So I think that's one big advantage is that you and I both know when we go to the conference, we have to make some tough decisions about which sessions to go to. Yeah. Here we'll be able to listen to all of them. I think we have until October 31st, so that'll be a challenge getting them all in that amount of time.
Yeah.
This is going to be interesting. You also explore a virtual expo hall where you can schedule one-on-one meetings with exhibitors and discover the latest technologies, products, and services. I'm just wondering how they're going to give us those pens, though. I
know, all the little freebies.
Yeah, all those little freebies. Maybe they'll mail them to us. I don't know. And then you can connect digitally with your peers to network, share ideas, and discuss best practices. I think that's going to be the toughest thing because that in-person part, I think that, we're getting used to these Zoom sessions or these virtual things, but I can't wait to see how they do it. But I think that's one of the challenges that you have in this virtual environment. It's just not the same. Sue, I've had this on the agenda to talk about for months, and we've just never gotten to it. But I did a couple surveys very recently, and in both of these surveys, just prior to the coronavirus lockdown, I found that they had a policy that was incorrect. It stated in their advance directives that they do not honor advance directives. Flat out said that they do not honor advance directives. And I knew what they meant, but they worded it incorrectly. First of all, it is really illegal to tell somebody that you do not honor to their advance directives. We know, from a legal standpoint, you have to give people decision-making processes. But what they really meant is that they're not going to honor a do not resuscitate order. So look at your advance directive policy, please. Look at those forms that you hand out to your patients. They hide in a couple different places. They hide in your policies and procedures. They'll hide in the forms that you provide to the patients. And they might be hiding even inside of your consents. So look to make sure that you do not have the phrase, we do not honor advance directives. You can't have language that says that during the course of care, a DNR order, a do not resuscitate order will not be honored. And that's the only thing you can say there. You have to honor advance directives. And let's face it, most advance directives are simply a proxy, when you're giving somebody else the right to make decisions on your behalf. So let's take a short break, and we'll come back to discuss more of our thoughts on where we are and where we're heading. So, Sue, as I took that break, I started to realize how many cables we have running through this place now. I guess 6 cameras and all the different equipment that we put in here. There's a lot of cables in here. This is a lot more crowded with all this equipment in here than it was before. Wow. So I thought we would talk a little bit about where we are right now. And I think a big issue that we're going to have coming up is what's going to happen with the surveys. We know that the surveys have been put on hold, and we'll talk about that in a second, but it's hard to predict. So whatever I talk about for the next 10, 20 minutes here is all, kind of speculative until we get more information. So if you're listening to this in like October, make sure you go back and figure out what's happened since April and to the current time. So I think we probably have to put a disclaimer on now about the timing of these episodes here.
Just dating everything. 'Cause
Yeah.
things change so quickly.
Yeah, so definitely please keep up with what's going on. Listen to us regularly. And by the way, while I'm on that subject, I'm still shocked at the number of people that don't know about our podcast. So please pass the information on to your friends. You know that this is free. You know this is a great opportunity to kind of keep up with things. And it's still shocking to me. Actually, it's still shocking to me, though probably shouldn't be, how many people don't actually know how to access podcasts.
Well,
please.
it really wasn't that long ago when you think about it. When
Yeah.
you started this, and at that point you had been,
I
you
didn't
had
know
just
anything.
found out about podcasts.
Yeah, I
and
didn't know
started
anything
listening.
about it. So what we do know at this point is that for all accreditation and CMS certification programs, through the accreditation organization, in other words, if you're doing deemed status surveys, that regular survey activity has been put on hold for now as we sit here on what is today, the 26th of April. Should your actual survey date occur after the accreditation expiration date, there is not going to be any negative consequences of missing that survey. So just be aware that everybody knows that everything is on hold at this point. There'll be more information coming out as we get out of this crisis as to what the timing is going to be. So organizations that participate in a deemed status accreditation program, CMS has indicated that the delay will not impact your ambulatory surgery center certification. So you're not going to lose your certification if you go beyond the accreditation date. The accreditation programs have all postponed non-emergency surveys for all deemed status and non-deemed status programs scheduled for a survey. And right now, so it seems to be through mid-May that they've held off. So again, we're here toward the end of April as we're recording this. If you're listening to this after that time frame, make sure you find out where we are. And Sue, why don't you mention what types of categories are included in this holding off?
Okay, so this includes routine deemed status or non-deemed status reaccreditation, special MDS and special non-MDS, interim and compliance surveys.
And the accreditation organizations are going to do their darndest to complete high priority emergency surveys for deemed status and non-deemed status surveys. We actually are in this situation. We have quite a number of centers that are waiting for their initial survey. And of course, it struck right at this time. So I believe we have 4 organizations that are waiting for early option surveys, and they've been prioritized, but it's very difficult to get surveyors right now. And of course, with travel limitations, with places being ordered to shut down, it's been very difficult. But prioritized surveys, in other words, those that are still occurring, if they can find a surveyor, include all discretionary surveys that address immediate jeopardy complaints. So, and this I can pretty much guarantee, if somebody complains about an infection control issue, you're going to see a surveyor pretty soon.
Yes.
And anything that involves allegations of abuse and neglect, et cetera, and any of those important things that would really bear on could potentially result in serious injury to the patients. And then another one that is being prioritized is initial Medicare deemed status and reaccreditation initial Medicare deemed status surveys if you're seeking a Medicare number. So those have been prioritized, though I will say at this point I know that the activity is very limited since the surveyors are very limited in being able to get out and do a survey. And, of course, a lot of these places just can't actually do any cases right now anyway. And then, of course, non-Medicare deemed status accreditation, those organizations that are seeking first-time accreditation with an accrediting organization, they are being prioritized if they can find a surveyor. All early option surveys in general, and any revisits necessary to resolve current enforcement actions. So, for example, if there's a follow-up Medicare deemed status life safety survey, something where they've identified condition-level items. So they are prioritizing those for purposes of closing out the survey event. And any organization, the other thing that they're prioritizing is those surveys for organizations that have a history of immediate jeopardy related to infection control. So if you've had infection control issues in the past that have resulted in immediate jeopardy finding, you might be visited shortly by a surveyor from your accrediting organization or from the state. It's important to remember, too, that you need to continue to submit your survey applications, even if you've been impacted by COVID-19. I actually heard the other day that there's a couple organizations that have actually furloughed their administrator and nurse manager, which I can't imagine, because when you furlough them, they can't even contact.
Can't do anything.
Yeah, you can't do anything without paying them, for that whole day that they're contacted. So, I mean, please, if you're listening to me and you're a owner of a surgery center or governing body member, you should not be furloughing those people that are making those difficult decisions about, how to ramp up. So definitely those individuals need to be continue to be employed by the organization. Note that any organizations that have completed applications on file will remain accredited until the next accreditation decision is rendered. That means for anybody that's seeking reaccreditation, of course. And then once normal operations resume, the organizations will schedule surveys. These accrediting organizations will schedule surveys through a catch-up process. I can't wait to see how that's going to be.
I know.
I usually do about 3 to 4 a year. I've already done 3 this year. And I know there's going to be heavy pressure on all of us surveyors to kind of get caught up on that. So you might not see me for a while, but no, I'll be around, especially with that puppy. So I thought I would let's just have some fun and do some predictions for the future.
Look in your crystal ball.
Yeah, look into that crystal ball. And I guess my past history in making predictions has been pretty bad.
Yeah. Well, I think number one, though, I think you're pretty accurate on this.
Yes.
It's going to be very, very busy. It's not going to be a good time to take a vacation for the rest of this year.
We've warned people, and I think for the most part, I don't know that we've been on vacation. We certainly haven't in the company, but those people that have, that have been furloughed, enjoy that time, because I think we're going to be so busy here on out. We got to get caught up on all of those surgeries that were not done during that time frame. And I think it's fair to say that it's going to take 6 months to get caught up on all of that. And then with that, I guess the next one's not too difficult to predict either. The funds are going to be very tight. Yeah. I've been called upon to do some of these consultations during my downtime. I've been doing paid consultations with organizations. I want to learn a little bit or about what's going on with the ASCs, and since I'm one of the nation's experts on that, I tend to be called on quite a bit. And a lot of these consultations are with vendors who are just trying to figure out what is going to happen over the next year. Actually, I have one tonight. I didn't tell you. I have one tonight with Hong Kong.
Oh,
so that's why it's in the middle of the night. It'll be Monday morning for them, but it'll be late to us. I don't know why Hong Kong wants to hear about it, but apparently some investors over there want to know what's happening on the equipment market in particular. And one of the things I've said is, if you're selling medical equipment, capital expenditures are definitely going to be down. Maybe not so much for new equipment or equipment that's worn out, but if you're looking to upgrade equipment, move to the latest technology, I think we're going to. Our clients are already saying that we've got to save some money. We're even with the the Paycheck Protection Program, people are very careful about how they're spending right now, and they're definitely not going to be looking to spending a lot of money on capital expenditures unless they have to expand or replace equipment that's broken down. And I am worried about some of the stress that's going to happen on some of the equipment that maybe have been pulled out of operation for a while. That's going to be interesting to see what happens. Yes. Also, I don't think we're going to see conferences very well attended for the rest of the year. Again, people are going to be too busy to do that. They're going and I think also there's been information overload. I certainly feel that way. Of course, we're part of it because we're doing a lot of communicating out there. We have a lot of conferences here, but the good news is ours are all recorded and you can listen to them at your leisure. But I think if you're trying to plan on doing an in-person conference, I think it's going to be very difficult to get people to do that because they're just not going to want to take the time.
And with us, we're trying to do things that are specific to either reopening or different things that you need to really know. And I think it's all people can absorb. Like with this podcast, we were trying to think if we should do more just general news, but really everybody's just focused on what's going on right
try
now.
To find
so
any
you don't
news.
want to
Try to find. I know you looked this
any
morning.
Other news than this.
There's no other news right now. However, there's a couple things that will be selling fast, and that we know that we're no longer going to be, keeping our inventory levels of PPE down.
Yeah.
Definitely, I think we can expect to see our coffers filled with PPE just in case something like this happens in the future. And of course, we are concerned about a relapse, come the fall. So I think we're definitely going to have that. And I guess toilet paper is another thing we're going to stock up on.
Well, I think with everything, I think even just as a personal thing, people are going to be more prepared.
Yeah,
because
absolutely.
we've seen what happened, and with this, we had a bit of warning. But when you think of what could come down the line next, it could be something where it's so sudden. You want to make sure you've got just enough of what you need to get through a little bit of isolation time.
Absolutely, and keep it up. But I think money is going to be tight, and we have to be careful. I am worried about the pharmacy issue, though, the drugs. We don't have a lot of information about this, and we're going to keep in touch with all of our pharmacy consultants on this. But we are concerned that certain drugs are going to be in short supply, especially those that are sourced from China. Not so much; it's not always the drug themselves that are coming from China, but also the raw materials that come from China. And we're not getting a lot of good information about what's happening out there, but we know manufacturing is down. So I think we could potentially see some shortages. So I don't want people to make a run on all of their drugs out there, but just make sure that you're maintaining healthy drug levels. And of course, one thing we're going to be talking about on Thursday, we don't have a lot of answers right now, and we might not by Thursday even, but what we're going to do with regard to testing of patients and employees for COVID-19 in preparation for surgery.
Yeah, your opening plans.
Yeah, and I think also, just kind of on a manufacturing note, I think we're going to be very hesitant about supporting manufacturing in China in the future, especially if we do have shortages as a result of that reliance on that. Yeah. I'm very proud to see that there's quite a bit of a movement back to supporting the United States, manufacturing in the U.S. and also watching as American manufacturers have stepped up very quickly. They've proven. I'm a fan of reading history books, and especially about the war effort during World War II and how American manufacturing stepped up. And really, what's happened here is the exact same thing that happened during World War II. How quickly manufacturers were able to retool and be able to manufacture things that they'd never manufactured before.
Yeah, and not just picking on China. I think the whole diversification thing is important because we've seen things even in other or even in our states. You know, if you have one area that's hit, it's very hard to bounce back from that.
Yeah. And then there's some things that are going to, I think, permanently change. You and I talked a lot during the fall about the flu shot and how important it was to take it seriously. And we weren't so actually we did predict some things there, but we as a country really haven't taken it seriously. Our employees haven't taken it seriously. I have a feeling that flu shots are going to be very popular in the future, and of course we're going to have a different attitude toward people staying home when they're sick. We had one of our centers shut down because an employee came in who was sick, ended up testing positive for COVID-19. And
of course, everybody talks about staying home when you're sick, but often in the healthcare field, we feel that pressure to come in anyways.
Right.
And I think that's really going to churn around.
Well, and it's going to be, not only are we not going to want to come in, but our coworkers are going to tell us not to come in. Yeah. So there's going to be that peer pressure to not allow that to happen. Yeah. I hope that we're going to be better able to handle a crisis in the future. Alex Borneman, our director of operations and our life safety expert, he and I talked quite a bit, while we were developing those emergency plans for our clients. And
incidentally, he has way too much fun with that stuff. He really gets deep. He really delves in deep.
He does, I know. But we had conversations about things like the pandemic, and we were really, we spent the last year really talking about active shooter so much. And we're saying, this is the one that we want to practice on. We never, well, I don't even know that we knew how to practice, or to drill for a pandemic.
I don't think so because, I had thought about, I've heard it said many times that the next big crisis will be from some type of bacteria or virus, but I would have never followed through and thought of all the different ramifications of that. I just couldn't have.
Yeah, no, well said. And now I think we're better prepared for it. I don't think we can't let our guard down. We have to assume this is going to happen again, and then hopefully we'll be better prepared for it. So I'm also hoping that people are going to be better prepared for surveys. Hopefully they've taken the time during this time off. I use that with air quotes to get caught up on their paperwork and their policies and their board minutes and everything like that. So hopefully you've kept up with it. I think the other thing that's kind of fascinating to me too, Sue, is that I think that board meetings are going to be very different in the future. We've talked about this a lot because virtually all the board meetings have been virtual. Virtually all. That's an interesting way to turn on phrase. And what an efficient way to do things. I mean, we know how challenging it is and how expensive it is in terms of time, at least, to get our board together. And you listen to the board, to the administrators talk about how impossible it is to get all the board members together all at once. Yeah. And we know that if we have a Zoom session, I hate to use a
any type of
virtual conferencing, that it can be much more efficient. You don't lose that time of driving to and from the center. You can do it from the comfort of your home. You can be eating dinner at the same time. I don't know how. Well, I've had to eat during some of those virtual conferences, and we've been able to hide that fact. But those are things that I think makes us much more efficient. And for consultants like ourselves, attending it virtually means that we, don't have that expensive travel to that organization, as well as that time that is taken in driving. I mean, 6 hours down to the city where most of our clients are right now. So I think board meetings and other major meetings that you hold within your organization we've proven can be done remotely through this type of a software. Now we all know how to use this software and we're used to it. I do think that that's going to change things dramatically. I'm hoping it will.
Yeah, and some of the docs, if they come in after they've been working all day and they've been waiting a couple extra hours until everybody's done working, if they can go home and take a minute and then get back on, or with us if we're driving the 6 hours and you're not going to be at your best.
No. So. Well, and then you got the travel problems, or traffic problems even.
Yeah,
it really wastes a lot of time. So I think that's one thing I expect. I don't know that quality improvement meetings are going to be able to be held that way, but definitely board meetings, any executive meetings, I think definitely can be that. And I think, again, maybe these predictions are not that difficult to make. Surveys are going to be focused more on infection control in the future. They really always have had a heavy emphasis on infection control, but just given some of the training that I've had to go through recently as a surveyor, everything is all about infection control right now. We're being taught, more about what to be looking for, what our expectations are, what those higher expectations are going to be. And it goes without saying, as I mentioned earlier, the surveyors are going to be way behind. It's going to be a struggle. We have a lot of pending surveys. We're going to be swamped ourselves, though I think it'll take a while for everybody to get caught up. And given our luck, probably all those surveys will happen on the same day. It'll be interesting to see how we deal with that. So let's take a short break, and when we come back, we'll have a very quick list, and that'll probably be less than a minute, to talk about upcoming events in the ASC industry.
You are never alone in the ASC industry. Many organizations are eager to provide an opportunity to keep up on all aspects of running an ASC. And in this section, we highlight upcoming events.
And if you'd like your event to be included in the podcast, please send the event information to us at info@ascpodcast.com, especially right now as we're having a hard time keeping up with what's been canceled and what hasn't been. We don't really have a lot on our list. So these are the things that we know are either on, and anything that we don't mention we believe has been canceled. So Becker's 18th Annual Future of Spine and the Spine Orthopedic and Pain Management Driven ASC Conference is still scheduled for June 18th through the 20th at the Swiss Hotel in Chicago.
ASCA's 2020 Transitions to Virtual Conference and Expo is scheduled for July 9th and the 10th, and will offer the same top quality education, networking, and resources as ASCA's in-person events, all from the safety and comfort of your home or office.
And if you are already registered or were registered for the ASCA 2020 in-person in Orlando, that your registration automatically rolls over to the virtual conference. I think on April 30th, they indicated that they're going to give information about what will happen if you don't want to go to the virtual conference. So stay tuned for that. The Florida Society of ASCs annual conference and trade show is July 15th through the 17th at the Walt Disney World in Orlando, Florida. Now, their website does say that due to the current impact of the COVID-19, they have suspended registration for the conference. So do visit their website regularly at fsasc.org for a current update. I do know that the Ohio State Association conference is still on, though. And that's go ahead.
And that's September 30th through October 1st, 2020, at the Hilton Columbus Polaris in Columbus, Ohio.
One of our favorite places to go. So hopefully that'll be the one where we can get out, Sue, and get to. So we enjoyed that conference quite a bit. So that's it for this episode of the ASC Podcast with John Goehle. And join us again, and please consider becoming a patron by going to our website at ascpodcast.com. And please spread the word about our podcast with your friends and colleagues, and do us the honor of hitting the subscribe button. The sound editor for this episode is Susan Cronkite. Executive producer is John Goehle. Research assistance is provided by Susan Cronkite, Jenna Alvarez, Judy D'Ambrosio, Alex Borneman, Zach Caloritis, and Lori Rodericks. Music is provided by Media Sushi and Mike Noah. And the ASC Podcast with John Goehle is hosted on Podbean and is available on all major podcast channels.
This podcast is an educational and operational tool and is not intended to be a comprehensive resource for all rules, regulations, and standards that an ambulatory surgery center must meet. The advice provided should not be considered as, nor does it constitute legal advice or opinion. When reviewing specific situations involving legal and regulatory issues, attorneys and other professionals should be consulted. This has been a production of Eden Group Development. All rights are reserved. We would like to thank our sponsors: Ambulatory Healthcare Strategies, Surgical Information System, Encompass Healthcare Data Solutions, BHG Patient Lending, and Medicus IT. For more information about our sponsors, please visit our website. If you're interested in advertising or sponsoring the ASC Podcast with John Goehle, please email us at info@ascpodcast.com. And we would love to hear your questions and comments. Please email us at comments@ascpodcast.com.